We're recording an average of 600 active cases daily in Ghana. The situation is getting worse, really. The very simple things that we've been asked to do, we know we're not doing it. Sometimes we need more reasons to do it, I guess. But nobody must tell you to mask up. You have to do it for yourself. You have to do it for your neighbor. You have to do it for your family and your friends. Let's have some real conversation on the back of the figures that we're recording these days. And when we were doing the review, just before we wrapped up, I shared a statement, really. And this was from a personal Facebook handle of this doctor, Dr. Radha Hackman, who's a medical doctor at the DUAC Clinic and a member of the Ghana Medical Association Covid-19 committee. She spoke to us in a very real way, asking all of us to have a plan. Impose your own personal lockdown, she said in that statement. We want to have a quick conversation with her on the back of this before we engage our virologist and immunologist here on the show. Dr. Hackman, very grateful that you could join us here on the AM show. Thank you, and a very good morning to you.
Hi, Mama V. Good morning. Thanks for having me.
Sure. And I've been following you. So this is not the first time you've written something like this. You've been given tips and given us reasons to always wear a mask. But what prompted this very last message that you posted yesterday?
Oh, Mama V, it's, I guess, from where I sit in my consulting room, I see the rising numbers of patients who come to me with symptoms, with flu symptoms. We test them. A lot of them test positive. And the source is, very clear. They've attended a social function, a wedding, a funeral. And I just thought I needed to speak about this.
This malaria that doesn't go away, or typhoid, I've heard. Have you witnessed any in your consulting room where you diagnose somebody of malaria and then they come back, malaria isn't gone, and then you have to finally do a COVID-19 test?
No, I haven't seen that at all. What I see is people come to me, they think they have malaria, or they've been to a facility a health facility, or they've been to a pharmacy. They think they have malaria. They've tested for malaria. The test is negative, but they still treat themselves or get treated for malaria. So the malaria, in quotes, doesn't go. And then they come for a follow-up, consultation or something. But I haven't seen anybody with malaria who has been treated for malaria and turned out to be COVID. Okay. It's usually not malaria.
Okay. So I guess that's why you say in that write-up that don't self-treat malaria. So that's to say, don't think you have malaria and so you're treating malaria. If you're not well, go to a hospital.
Yes. And if the test for malaria is negative, insist on getting other tests done. In fact, insist on having a test for COVID, because not all cases of COVID have respiratory tract symptoms. Frequently, I see people who just have headaches. They talk about body pains. They talk about fatigue and tiredness. Again, these are typical malaria symptoms. But if you test for malaria and it's not malaria, go on to do a COVID test.
Should we begin to do like a mandatory COVID test if anybody walks into your clinic, for instance, does not necessarily complain of the usual symptoms associated with COVID-19? Shouldn't we be doing COVID-19 tests in addition?
Yes, I think we should. The problem is the PCR test is expensive. Getting the free test done through the public facilities can be cumbersome. Some say that the results take a long time to come, and they get a bit impatient. If it was possible to get these tests done quicker, maybe more cheaply, free of charge, as it should be, I think more people would get tested. So the testing should be made less cumbersome, and I think clear guidelines should be given by the Ghana Health Service. They should remind us what the protocols are. If you don't feel well, what should you do?
And I guess as you posted this message, some people perhaps reached out to you privately. Have persons contacted you once you posted your message yesterday?
Countless, several.
What is
Countless.
so? What is the common? What is common about what they've been telling you?
Usually, they talk about not feeling well. In fact, some will even say, "Oh, they had a runny nose last week, or they felt unwell 2 weeks ago. They did a COVID test and it was negative. So they treated themselves for something else, malaria usually, but they still feel the same way." Yes, sometimes at the beginning of the symptoms, you could have a test that comes out negative. But if you give it a few more days and you repeat the test, usually that test will come out positive for people with COVID.
Mm.
Of course, it doesn't mean that every fever or any feeling of unwellness is COVID, but that's what's going around now. And you definitely have to make sure that that's not what it is, especially if you have a history of having contact with someone who's tested positive, or if you've been to a function and you've let your guard down, you really should be thinking about it.
Let me ask you a very personal question. My children are going back to school. When I read the bit about your message that says, impose a personal lockdown, what should I do about them?
That's a difficult one. We're in the middle of a surge at the moment, and children going back to school right now should be. I mean, it is quite risky, I think. I don't know how easy it is to enforce protocols with children. I don't know. But from what we've been told, all schools have been linked with health facilities. So if children come to school and they're not feeling well, or teachers are not feeling well, they should report to the health facility and, I suppose, get diagnosed. But it could be a bit difficult, I think.
Yeah. That's the place where I am right now, but thank you. Just finally, on the last leg of that statement about eating a lot of fruits, drinking water, and going out there to take fresh air, can you highlight on that again for us?
Oh, yes, absolutely. Outdoors is a great place to be. Fresh air. A lot of us work in offices, in air-conditioned offices with the windows closed. I think you're more at risk in an environment like that. If you can keep your windows open, get ventilation, I think that should help, protect you. Exercise, vegetables, fruits, all these things boost your immunity. A good night's sleep, avoiding stress, yes. And by fruits, you know what fruits are we're talking about. And don't just stick to one fruit. An orange looks completely different from a pawpaw. So you're getting something from a pawpaw you're not getting from an orange. So a variety of fruits. There are lots of local fresh fruits, local fresh vegetables. Your diet should be balanced. And these form, a very important part of should form an important part of everybody's diet. Drinking lots of water, staying hydrated. These are things that, are very important and help to boost your immunity. Because at the end of the day, there really is no cure for COVID. It's your body that fights the disease. So your immune system has been tip-top shape to be able to prevent yourself getting it. And if you do get it, to fight it successfully.
Yeah. Well,
Mama, can we talk a little bit about social function?
Yeah, sure. Please do.
Yes. People they invite you to a function and they say things like, all COVID protocols observed.
Strictly, they add these days.
Strictly. And what it usually means is you walk into the function, you wash your hands, use sanitizer. But then once you get in there, you're offered a drink. And that's where the trouble starts. You're offered some water. You're offered some food. The mask comes off. You're now in close proximity with other people who are also not wearing masks. You're talking, you're laughing, you're singing, whatever. That's when people get infected, But people seem to forget that bit, and they think that once they've washed their hands or once they've sanitized their hands before they eat, they're safe. You're not. You catch COVID from breathing in the air, the breath, the droplets from another person. So if you're not wearing a mask and you're talking to somebody else who is also not wearing a mask and who may be infected, there's a very good chance that you'll get infected. especially when the function is held indoors. There's a good chance you'll get infected. So I would say impose your own personal lockdown. It's not every function you have to go to. If you're invited, just waive the odds. You're responsible for your own personal safety. You don't have to go. Or if you go and it's time to eat, you can move away in a very safe distance from everybody else. Eat, put your mask on, and then come right back. But sitting together with a group of people who are not wearing masks, eating, drinking, nah, it's a no-no.
Well, Dr. Radha Hackman, what you've just said really, really revealing about the parties and the drinks that you're offered, and you take off your mask obviously before you drink and eat and you have conversations. Well, thank you really for sharing. Thank you for writing, and please don't stop writing. We will take our own personal lockdowns just as you've directed on that page. I am grateful that you agreed to speak to us here on the AM show.
Thank you.
All right. Dr. Radha Hackman is a medical doctor at the GIAC Clinic and a member of the Ghana Medical Association COVID-19 committee. She wrote a personal, this was on her personal Facebook page, something that speaks to all of us, and we thought that it would be good to have her. So hopefully we're listening and we're going to be doing what she's recommended.